everyone, and welcome to the Equal Hope segment on CAN TV. My name is Leilani Lacson-Soltysiak, and I'm the Data and Communications Coordinator at Equal Hope. For those who are not familiar with Equal Hope, we are a nonprofit organization, and we try to help eliminate health disparities in Chicago. We do this by offering free mammograms, free cervical cancer screenings, provide assistance with getting different types of vaccinations, link people to medical homes for free. So if you don't have a primary care provider, we can link you to one. And we offer other services too. Give us a call today. Our number is 312-942-3368, and you can also visit us at equalhope.org. You can also find us on social media. We have Twitter, Instagram, Facebook, and TikTok. I also wanted to mention we now have cancer support resources on equalhope.org. We have helpful handouts and links for patients, caregivers, and providers. So let me introduce this month's guest, Dr. Nita Lee. Dr. Lee is the Associate Professor of Obstetrics and Gynecology and Assistant Director of the University of Chicago's Comprehensive Cancer Center Community Outreach and Engagement. Dr. Lee specializes in the diagnosis and treatment of patients with gynecologic malignancies and focuses on a patient-centered approach in cancer survivorship and disparities. Dr. Lee, thank you for joining us this month.
Thank you so much for having me.
And also Dr. Lee is on Equal Hope's board too. So September is National Ovarian Awareness Month and Gynecologic Cancer Awareness Month. And today Dr. Lee will be discussing gynecologic health with us. So just for some background, each year around 110,000 women are diagnosed with gynecologic cancers, and there are approximately 32,000 deaths because of these cancers. Today is the perfect time your Well Woman exams should be scheduled, and also time to determine if someone you love is due for an important preventative health screen. The earlier cancer is detected and treated, the better. It is important to pay attention to your body and know what is normal for you so you can recognize signs and symptoms and maintain good gynecologic health. In addition, your doctor can discuss with you your family history as well as certain risk factors, things that increase your chances for getting gynecologic cancers, and how to lower your chance. How often a woman needs a checkup can vary based on individual medical needs, but women should see their healthcare providers regularly. So Dr. Lee, tell us about yourself and how you got into the medical field.
My name is Nita Lee, like I said, and I have been doing this, as we talked earlier, for about 15 years. And I got into the medical field because I really appreciated being able to have both a personal connection to patients as well as an ability to work in sort of public health.
Great. So September is National Ovarian Cancer Awareness Month and also Gynecologic Cancer Awareness Month.
Recording in progress.
What are the signs and symptoms of gynecologic
Recording
cancer?
stopped.
Sorry, that one, it had said recording paused, so I therefore hit recording like to play. So I don't think any of the stuff that you had, I can't tell if it recorded.
It's actually recording in the studio.
Okay,
Yeah.
sorry, I apologize.
It's okay. No, it's okay.
You can edit that out. Sorry about that, I got nervous.
It's okay. So tell us, what are the signs and symptoms of gynecologic cancers?
So, this is very important. There can be a range of those. And so different GYN cancers can have different symptoms, but some, like for example, the big categories of symptoms can be abnormal bleeding. So this could be definitely bleeding after menopause, which could be a potential sign for uterine or endometrial cancer or cervical vaginal cancers. And then ovarian cancer, which is less common, but can have more vague symptoms, but those can be things such as pelvic pain, bloating, changes in appetite, changes in like your urinary system or how your bowels or bladder is functioning. So those are kind of the bigger symptoms. And obviously anything that seems different and new to you is important to get looked at.
And just to make sure we're covering it, so it's cervical cancer, ovarian cancer, uterine cancer,
Yeah, and the less common cancers beyond those three are cancers of the vagina, which is the walls of the internal, or the vulva, which is the
Vulva.
skin on the outside in the genital area. So those are all, those five kind of below the belt cancers are what we focus on for the month of September and all year long, but definitely raising awareness this month.
Okay. Well, that's a good way of remembering the below the belt cancers. So what increases women's chances for developing these cancers? Are there lifestyle behaviors, diet?
Yeah, there's a range again, because sometimes these cancers are random and they happen without a lot of things. But I would say that like each cancer has its own sort of risk factors and characteristics. For example, cervical cancer and many vulvar and vaginal cancers are linked to HPV, which is a virus that is very, very common for anyone who's been sexually active. And so that's something that can be a risk factor and can be made worse if you have immunocompromise, such as HIV or transplant or lupus, or could be affected if you smoke, for example. So that would be sort of those categories. Uterine cancer and certain types of uterine cancer have definitely been increased risk in women who, or in patients who have a uterus and carry extra weight. So obesity, sort of lack of physical activity has been known to be associated with certain cancers, all like, that are throughout the body, but uterine cancer or endometrial cancer is the number one that's known for that one as well.
Are there certain racial or ethnic groups that have higher chances of developing any of these gynecologic cancers?
It's a little bit, it's hard to say, because sometimes there are differences in the incidence or the number of cases in certain groups, or there could be differences in mortality. So who's dying of these cancers? So for example, uterine cancer is a very good example, in that in general, white women and Black women may have similar rates of getting uterine cancer, but we know that Black women's mortality from uterine cancer is much higher for a multiple of reasons. We also know that even though cervical cancer is going down as a whole in the United States, it's actually not going down for specific groups, which is Hispanic women and Black women. And those women also have potentially higher rates of dying from this cancer. So there's a lot of complexity to it. So it's hard to know whether, it's one group or the other that's at risk, but a lot of it has to do with like the structure and the healthcare systems.
Okay. So why is it important for women to receive good gynecologic care?
I think of this as part of sort of like when you think about like a well person visit and you think about all of these things, I think of like the below the belt cancers or things that we don't like to talk about. So sometimes women will be engaged with their healthcare provider during the time that they're potentially interested in getting pregnant or are going from like having children. And then afterwards, sometimes people kind of slack off. They're like, well, do I really need to go? I don't really have any issues. I'm doing fine. But unfortunately, these are cancers and other conditions that could potentially be caught early, lead to early detection, lead to help better manage symptoms that may occur that are not cancer related. But, so I do think that as part of a physical exam and part of a check-in, thinking about gynecologic health is really important.
So how often should women be going to get...
This is very controversial. Like in my book, in my opinion, that once a year makes sense to me, right? So Pap smears are no longer recommended one every year. This has become a lot of confusion. So because people often confuse a pelvic exam with a Pap smear. A pelvic exam is someone doing a visual inspection or perhaps with the speculum doing a looking inside inspection. And the Pap is a test and an HPV test that can be done with when you're looking at the cervix. And so even though you don't need the Pap and HPV test every year, doing a visual inspection, making sure nobody feels any enlargement of the uterus, enlargement of the ovaries, all of those things, annual exam is really probably recommended. That being said, there are some groups that feel like, hey, I don't know if that's a good use of resources. Does everybody really need to go every year? So there is a little controversy about that, but I do think in general, my thought would be at least every year or every other year if you can't do every year.
So what do these exams entail?
So like I said, exams or like kind of seeing a provider really entails them checking in with you about things such as like irregular bleeding, pain, changes in your cycle if you still have a cycle, changes in your bowel or bladder function. Those would actually trigger them to maybe ask other questions or do other types of tests. Then there's the external visualization. There's an internal visualization with the speculum. So you look inside, you see if the person's up to date with pap smears, if they need to collect that at the same time. And then there's something called a bimanual exam where we place one finger inside the vaginal canal and on the top of the belly to kind of feel if we can feel any enlargements or irregularities.
So these exams are simple and they're fast?
They're pretty simple. They're pretty fast. I'm not going to say they're the most comfortable because nobody really loves going to the gynecologist, but like there's a lot of things that we do that we don't love to do. But a lot of the screening tests, colonoscopy, mammogram, pap smear, and HPV testing are not the most comfortable. Like we don't want to do it all the time, but we know we have to do it.
What are some reasons why women don't go in to get checked?
It's a really good question. I think there's like a whole host of reasons. Obviously, one of the things that I really appreciate about Equal Hope is like just the navigation through the healthcare system of making sure, do you have insurance? The Illinois Breast and Cervical Cancer Program is a free program for women to get breast and cervical cancer screening, and that does include a pelvic exam. So that's actually a really great way to get connected if you don't have insurance, and Equal Hope is one of the partners who is a lead agency now for that. So sometimes it's insurance, sometimes it's time, sometimes it's I'm just too busy. I have other priorities. During COVID, it was like, I'm scared of the healthcare system. I don't want to go. Sometimes even people who have insurance, there was an older study that showed that 8 out of 10 women who had insurance, like there were still gaps in being up to date for cervical cancer screening, for example.
Do you think
There's also, sorry, go ahead. I was going to say one other thing was that I think there's a lot of like, it's uncomfortable. Some women who may have had a past experience with either trauma or abuse may also have a lot of like triggers when you're thinking about pelvic exams. So they're particularly uncomfortable or stressful. And so those things all add up together.
Okay. I was going to mention, I did my master's thesis here at UIC, and it was about why women don't go in for their cervical cancer screenings and like their knowledge about HPV. And one of the big factors was a cultural thing. Like some cultures say, well, you shouldn't be going for these screenings and these tests because you're not married yet. Like once you're married, you get that stuff done. But,
Right. I totally agree. Yeah. I mean, I think that is kind of what we often talk about, that the below the belt cancers have the stigma that somehow like you're related to sex. And if you're not having sex, or if you're, you're not sexually active, or that some people feel, that there's cultures and communities that believe that maybe getting a pap smear is something that only people who've had a lot of sex partners should get, or, and so all of those things I think really weigh into an individual's decision. And I would love to read your thesis someday.
I should send you my slides. Okay, so how has COVID-19 impacted gynecologic health and getting screened, getting tested, procedures?
Yeah, I mean, I think in general during 2020 and even into 2021, there was a lot of hesitancy to come to the doctor because of just kind of fears of COVID infection, right? Even though then at certain times, like in the first few months, we actually did stop routine screening, quite honestly. And so we have women who were missed during that time period. Then we have people who lost their insurance during COVID. And so that kind of changed the landscape. Then we have people who were sort of like, between jobs and couldn't take time off, or were taking care of a loved one who had COVID or some other complication. So all of these things really meant that people somehow, I think as a whole, we were worried that we were going to see delays in care and delays in like preventive. And so we're really hoping that people really take this year as to say, hey, look, now we're back up. People, the hospitals have been back and up and running, clinics are available, to really say it's safe to come in and make sure you're up to date with all the things that we may have missed in the last few years.
Do you think more women are coming back to the clinic around like in 2022 now?
I think so. I mean, I don't have like the data to say anecdotally, but I definitely have patients who are coming back to see me and they're like, yeah, I know I didn't see you since 2020, but this was really a stressful time for me. So I do feel like I'm hearing that a little bit more and more. So I don't know if the data will bear that out in terms of like the number of pap smears done or HPV tests or things like that.
What are some conditions that you see frequently in your practice?
So because I'm a GYN oncologist, I really do focus on those types of cancers as well as the precancers of the cervix, which is kind of women who have abnormal pap smears. And so those areas are kind of the main 5 areas that most of my patients will have. And so sometimes I'm seeing patients who are newly diagnosed and we're coming up with a plan. We also see patients sort of like in surveillance after a cancer diagnosis as part of their survivorship care. So it kind of ranges.
Okay. So why is it important for women to know their family's health history?
So this is really critical because many cancers, including some of the GYN cancers, can have linkages that are hereditary. So most GYN cancers in general will not be hereditary. For example, cervical cancer, vulvar vaginal cancers tend not to be run in families, but are HPV related. Endometrial cancer, about 3% of women who have endometrial cancer may actually have something called Lynch syndrome, which is a hereditary condition that predisposes them to uterine or endometrial cancer. Colon cancer, the 2 big ones, but also potentially to other cancers such as cancers of the kidney, other breast cancers, and other things like that. The big one that people often hear about is that up to 20 to 25% of women who have ovarian cancer may have a family history. So many women won't, but they may have a hereditary breast and ovarian cancer condition, which may be predispose their risk of getting ovarian cancer to a much higher rate than the general public. And that knowing that family history is really important at a younger age so people can get tested. They may have preventive surgery. They can have other tests done. And, genetic testing is recommended for all patients with ovarian cancer.
So one thing I was going to ask about is the BRCA BRCA
Yes,
mutation.
and that's exactly an example of that. So hereditary breast ovarian syndromes, one of the most commonly known ones is BRCA, the BRCA1 or 2 mutations, which can increase your risk for ovarian, fallopian tube, and peritoneal cancers. And breast, obviously, yeah. So those are all linked together.
I thought it was only for breast, the BRCA mutation.
No, so BRCA is actually was found in breast cancers, but if you have BRCA1 or BRCA2, your risks of developing ovarian cancer may be between like 15 and 40%.
That I didn't know. Interesting.
It's very, very important. So knowing your family history, regardless of your racial or ethnic background, or, is really important because sometimes that's what will trigger women to come early, get tested early, potentially undergo preventative measures. Those are really critically important for GYN cancers for sure.
Okay. So for some people, having the conversation of family's health history might be a little difficult for some, especially if a family member died of cancer. It was
Of course.
It was very painful for them. How can someone have this conversation with their family? How can they initiate it?
I think it's something that's very difficult because, and one of our, sometimes we think about what people keep more secretively in families and how do we bring that out? And sometimes we think of it in terms of what's a way to honor your loved one, right? Like if your loved one was a beloved aunt or a grandmother, right? That's probably somebody who was caring for the family, wanted to take care of the family, and they would want to do their part to take care of their family, right? So sharing their story and talking about it or asking somebody about it may be a way to really honor their, their experience and what they went through. So that's kind of sometimes how we think about it.
Yeah, so I do the social media for Equal Hope, and a lot of the CDC videos that I come across on YouTube are about I decided to get tested. I decided to do this with my health because my mother had this, my mother had that. So they tie in, a lot of these videos tie in family health history. Talk to your family. You need to know your family's health history in order to take charge of your health.
I think it's really important because it is an element. It's not for everybody, meaning it's not that but it's also patients who are newly diagnosed. It's also incumbent, it's important for them to be able to understand what diagnosis they have and then now share that with their family, right? So they actually become the more active person to say, hey, look, I had ovarian cancer. I got genetic testing. My testing said I was positive. I'm going to have you work with my doctors to get tested yourself if you want it. So it's really important to kind of think of that how those ripple effect of getting testing can be.
So how can a vaccine reduce a woman's chance of cervical cancer?
So this is one of my favorite topics. So HPV is a virus that everyone can get exposed to. It is kind of technically sexually transmitted, but it is so common. 80 to 90% of people have it, you know. And if you get a vaccine, it is not a live vaccine. It's actually a vaccine that's recommended for boys and girls ages starting at age 9. 9 to 15-year-olds can get 2 shots. If you're over 15 to 26, you have to get 3 shots. And it is now approved for up to age 45 in select patients.
Oh, wow.
So that vaccine actually allows your immune system to create antibodies against HPV so that in the future, when you're exposed to HPV, which everyone will be at some point in their life, then your body can actually respond and fight that infection so that there is decreased rates of the HPV staying in the cervix cells or staying in the genital tract cells and causing these cancerous changes.
So you said that it's safe for people as young as age 9.
Yeah, so the standard recommendation is for boys and girls 9 to 15 ideally because they have the best immune response, and then up until age 26 for sure. 26 to 45, it's important to talk to your doctor, but it is FDA approved and many people are getting it, and we are recommending it because HPV vaccines protect against cervical cancer, vulvar, vaginal, anal cancer, and cancer of the head and neck and throat, which is also increasing.
So it protects against many cancers, not just one.
Correct. Yeah,
Great.
Exactly.
So besides the HPV vaccine, what else can women do to lower their chances of developing gynecologic cancers?
You know, I think it's tough because sometimes the genetics, you have to kind of know the genetics and know what those are like more specialized procedures that may be done. But in general, I think all of us need to be shooting for sort of like, you know, like a little bit of the things that we know that are good for us, healthier lifestyle, trying to be, you know, proactive about physical activity. You know, there is data on sort of like red meat and kind of like more processed foods, but all of that is hard to kind of pinpoint. But I think those healthier habits in general do help. And then I think it's really paying attention to your symptoms, getting regular care, and really advocating for yourself if any of these symptoms occur. So kind of bleeding that's irregular, pain, you know, new onset of changes in bowel or bladder function, all of those things can be signs of gynecological cancers. And so we really want people to kind of link in and see their doctors for this.
Okay. So we have about 3 minutes left. So you are also the Assistant Director of the Comprehensive Cancer Center Community Outreach and Engagement Leadership Team. So you work to support community collaboration and education to reduce cancer disparities. How has this work impacted you in the communities of University of Chicago?
You know, this has been a very meaningful part of my career because I feel that, you know, as a clinician, I work one-on-one with patients and families, but as a, you know, I still saw that there were still problems, right? Like we were still getting the same diagnoses, advanced stage cervical cancer, women with uterine cancer, you know, so I think that this allows us to take the experiences we have as physicians or as patients, and we have a lot of wonderful survivor advocates who really share their stories, so that we can kind of make impact sort of like more upstream, if that makes sense. Like thinking about like how do we make a public health impact is really, really important because I would love not to see patients diagnosed with cervical cancer anymore. And I would, you know, so I feel like our impact is to try to take our experience in oncology and say, okay, how do we catch things upstream? So our partnerships are incredibly important because no single institution or single doctor or nurse or provider can do it by themselves, right? But I think we can really extend our reach through community networks, through our patients and their community networks. So I think all of this thing kind of builds together.
Great. That sounds like really great work that you guys are doing.
No, we're excited about a lot of the things and the partnerships that we have with Equal Hope and organizations like this.
Yeah, we're very excited to have University of Chicago on board with our different initiatives. So we have about a minute left, Dr. Lee. Give us some tips on how women can be best advocates for themselves.
I would say know your body. Don't be afraid to speak up. See your doctor. Sometimes even get a new doctor if you feel like you're not being heard. We do have our Foundation for Women's Cancer has a great, it's called Move the Message. So if you Google remove the message, Women's Foundation for Women's Cancer. You will see pamphlets, handouts that really go over all of the GYN cancers in particular, and can really provide a lot of information to you or any other, groups that would want that information. So share that message about, really knowing your body, knowing the symptoms, and reaching out and not being afraid to reach out for guidance.
Great. Well, that's all the time that we have, Dr. Lee. Thank you for joining us on our segment tonight. And tune in next time in October 25th from 5 to 5:25 p.m. Thank you for watching. Good night.